Good morning, everyone. My name is Corinda Rainey Moore, and I am the board chair of Safe Communities. I would like to welcome all of you and thank you all for being with us today. And we appreciate your joining us for this outstanding panel discussion we're going to be having today. A special thanks to the Safe Communities of Dane County Falls Prevention Task Force, the Area Agency on Aging of Dane County, the African American Opioid Coalition, United Way of Dane County, and the City of Fitchburg Fact TV for making this event possible. September is National Falls Prevention Month. In lieu of an in-person falls prevention event, Only Leaves Should Fall, we're holding this live virtual chat with Dr. Zorba Paster and with a stellar panel of individuals who will provide different perspectives on falls prevention efforts and the impacts that falls have on individuals in our local community. Some of you might ask, why should we care about falls? Well, Wisconsin has the highest death rate due to falls for older adults of any state in the country. And falls are the number one cause of injury, death among older adults in the state of Wisconsin. Dr. Zorba Paster will kick off today's event by talking about why we should care about falls prevention efforts and will share some strategies that we can implement to help prevent a fall and stay upright and independent. After Dr. Paster speaks, we'll move right into our panel discussion where you're welcome to enter questions into the chat throughout this whole discussion. And I would like to now introduce Dr. Zorba Paster. Dr. Paster is a practicing family physician at the Dean Medical Center near Madison. He was born and raised in Chicago, received his pre-med degree from the University of Wisconsin-Madison, and his MD from the University of Illinois, Chicago. He did his internship and residency at Dalhousie University School of Medicine, Halifax, Nova Scotia. On Wisconsin Public Radio, he co-hosts a popular weekly call-in show about personal health issues called Zorba Paster on Your Health. In addition to his weekly show for Wisconsin Public Radio, Dr. Paster provides weekly medical commentaries on Wisconsin TV in Madison and writes a column for the Wisconsin State Journal. Dr. Zorba Paster, you have the mic now.
Well, thank you very much. Thanks very much for inviting me here. I really, really appreciate it. And it gives me a chance to really talk about health and wellness. I love talking about health and wellness. I've been doing it my whole life, first in the office on a one-to-one basis, and then also sort of exactly what we're doing right now. And it's very interesting. Years ago, when I first started doing any work that I did with outreach, with my public radio show, my stuff on News 3, and also with newspaper, I realized that you can be one-to-one in an office talking with people, and that's one issue. But actually, the way we're actually connecting right now through Zoom is a whole other way to actually get to people and actually begin to change some of our thoughts. So let's go into falls. So why do we want to prevent falls? Because preventing falls is a way to live a long, sweet life. You go to your doctor and we talk about heart disease, we talk about cholesterol, we talk about blood pressure, and we talk about, are you eating right? Eat a more Mediterranean diet. Don't eat as many brats. Throw away the Oreos. You're eating too much chocolate chip cookies. But we don't always talk about falls, but falls are a leading cause of death and disability. And Wisconsin is number one for falls. That's not a great thing to be number one for. I mean, winning the NBA championship, being number one, I'm proud of that, but I am not proud of the fact that we're number one in falls for death in the country and stuff. Now, there's a good question. We don't know exactly why we're number one. Look at Minnesota. Minnesota is way down there. I mean, that's a very similar culture to Wisconsin. So why are they doing a better job in Minnesota than we are here, it doesn't make sense. And then other people look at it and they go, well, maybe we drink too much, we have too many brandy old-fashioned sweets, and that's the case. But in Minnesota, even though they don't drink brandy old-fashioned sweets, they still drink. And they have fewer falls than we are. So we don't have the answer to why. And they also have ice, by the way, just like we do, probably more ice. So we don't have an answer as to why we have more falls. But we do have answers on why to prevent falls. So why do we want to prevent them? If you're 65 and you fall and you break your hip, what happens? 25% chance that you will be dead within 2 years. Now, I had a patient the other day who said, well, why am I going to be dead in 2 years? Well, surgery has complications. You don't breathe as well, so you get pneumonia. You get complications from either the pneumonia or not breathing well or staying at home. There are lots of causes for it. You don't just die from the fall, but you die from the ramifications of fall. P.K. Wrigley, who had more money than God herself, P.K. Wrigley died 2 years after he had a fall, after he fractured his hip fracture when he was 65. He was a great guy, had a lot of money. Gum empire didn't make any difference. He died because he fractured his hip. And it's very important then to prevent those fractures. There's a 50% chance that you will be disabled in one or more activity of daily living, like dressing yourself, going out, washing the clothes and other things if you fracture your hip. So you don't want to fracture your hip. You don't want to hit your head. My Aunt Myrtle fell on the way to the mailbox. She was 85 years old. Why? Because she didn't have the walkway shoveled, and so she slipped on the ice and fell. Fractured, got her head, got a subdural hematoma. She was dead 3 days later. Other than that, she would have been okay. She was otherwise a healthy 85-year-old. So a few tips before I pass on them away. Number one, make sure your house is well lit. How do you make sure your house is well lit? You might have to put in more lights. When the LED lights are on sale, change all those light bulbs to LED lights. Why? Well, first of all, they're much cheaper than they used to be. And second of all, you will save a ton of money when it comes to your electric bill. I don't know if it's like 10% or 15% or maybe up to 20%. I don't know what the number is. But a lot of our electric bill is due to incandescent lights that were invented by Thomas Edison in 1890. We're talking about 130 years ago, and we're still using the same technology. LED lights, 95 to 98% of the energy goes towards light. You put the bulb in, and you don't have to change it, if you get a good bulb, for 10 to 15 years. You'll no longer say, I've got to have bulbs in the house, and if you get LED bulbs. So change all your light bulbs to LED bulbs when they go on sale. Right now, they're on sale everywhere. They're on sale at Walmart. They're on sale at Shopko. Well, not at Shopko. Walmart. They're at Home Depot, all over the place. They're even on sale in Walgreens. But find where they are, LED lights. Put more lights around the house so you can see when you're walking around. Throw rugs. They may look good, but they're not good. If you slip on a throw rug because you're not lifting up, you may get a hip fracture. So look at those beautiful throw rugs, especially ones that you've had for years if you like them, and give them away. Give them to your children or your grandchildren or someone else, or bring them to Goodwill or something else. But throw rugs are a great way for people to fall. You don't need them, especially you have to be careful in the bathroom. Lots of people fall and kill themselves in the bathroom. Why? Because when they're sitting there on the commode and they're having a bowel movement, they get a little dizzy sometimes. They stand up, they have a throw rug, and they fall. So look at your bathroom. If you've got a throw rug in the bathroom, so when you come out of the shower, you actually are drying yourself, and make sure it's not a throw rug that moves, but it's something that has stickers on the fall. Very, very important. The next thing is use a walker. You may not want to use a walker, but if you're a senior citizen, get to it. You're old. Nothing wrong with being old. My father, God bless him, died at the age of 87. He sold gumball machines. And in the last part of his life, he was actually selling, believe it or not, fake antique gumball machines for dogs. Now, these were gumball machines that looked like a gumball machine, but he would put gumball, instead of gumballs, you put doggy treats in, pushed it down, and the doggy treats came out. And there's a reason I'm telling this. And he would go out and on the road and sell them to customers like Walmart, Target, and other places. He loved saying that he was old and mobile. He didn't say he was mobile, but he loved the fact that he was old. I think one of the problems with using a cane using a walker, and for that matter, hearing aids, is people are embarrassed to say that we're old. If you're over 65, you are old. Embrace it. And then use the things that you can use to keep yourself upright. In other words, so you can make sure your walkway is shoveled when you go outside, got rid of the throw rugs, put lights on and everything. In other words, realize there's nothing wrong with using devices like walkers or canes if they're going to keep you falling, because they will keep you upright longer, and you will be old and active versus old and in a nursing home, or old and not able to do the things that you want to do. So that's my recommendation. We only want leaves to fall. We don't want you to fall. And if you take some simple steps, you really can make a difference in your life. Just some simple steps and thinking about it, because you don't want to fall. You don't want to be disabled. You don't want to die of an accident. And in Wisconsin, there are too many people that do that, have done that last year. I'm going to do it this year. And everyone on this call, if you look around and take action, you reduce your risk of fall and you will live a long life. And that's a sneeze or a dog. Anyway, thank you very much. Appreciate it. And I'm handing it off to, who am I handing it off to? I can't.
Me?
I'm sorry, thanks. Sorry.
Thank you. Thank you, Dr. Zorba Paster, for that very nicely laid out rationale as to why we should care about people being safe in their homes and not wanting people to fall. And as you mentioned, we only want leaves to fall. We don't want people to fall. So thank you. And a reminder for folks to, if you have questions, put your questions in the chat. We will be taking questions from the chat in a few minutes. But before we do that, I would like us to transition to our panel of experts. But I'd like to remind you all that if you're interested in any follow-up or virtual home safety assessment or information about community resources, please send Ashley Hillman a message in the chat, or you can also call or email her. And Ashley, if we can have you put your email in the chat, that would also be great. For anyone who's registered, Ashley will get back to you regarding your questions or concerns and making sure that you're connected to the resources you're interested in. And now I'll transition to our panelists. We have Dr. Roanne Osborne, who is the Chief Medical Officer at Mercy Care Health Plans. We have Mr. Corby White from the state of Wisconsin. He's a health manager. We have Ms. Charlie Daniel, who is the founder of the African American Opioid Coalition, and her title is Diversity and Inclusion Manager at Safe Communities. And then we have Dr. Judy Duane, who is an associate professor of physical therapy program at UW-Madison. And they will all talk a little bit more about who they are and give you a little bit more information about their background. So we will start with Dr. Roanne, and we will throw out our Roanne. Dr. Roanne, if you want to share any additional information about yourself, go ahead.
Great. Thank you so much for inviting me today. I'm so glad to see so many folks here interested in learning about fall prevention. So I'm a family practice doc by training, and I currently work at a health plan, but we're seeing patients for many years before that. So one thing I want to thank Dr. Paster for his really incredible introduction, but also sometimes we forget if we've had a slip or a fall, to tell our providers about it and our physicians about it. So one thing I would like to add is that if you've had a slip and you think it's even insignificant, or you've had a fall, maybe to write it down, because a lot of times we get to the doctor's office and there's so many different things that are coming at us that we forget that there are things that we may want to mention. And so even if it is a nurse, sometimes for the Medicare wellness visit, they do ask about falls, so you can let the nurse or whoever's doing that talk to you about that as well. And then, have your list so that when you go to the doctor or you go to your provider, that if you've had a fall, you let them know it's on your list to mention to them, because sometimes we forget. Thank you so much.
Thank you so much, Dr. Roanne, for that great introduction of yourself. And I think that is very important that folks do provide their doctor with the accurate information about what happened with them and what's going on in case they do fall. The doctor does need to be aware of that because it could be some issues related to your health or some medication adjustment that also needs to happen. So next, I'm going to invite Mr. Corby White to say a little bit more about himself.
Thank you so much, and thank you all for having me this morning. I'm subbing in for Aaron Perry, but still I'm here. I'm the state of Wisconsin's health program manager. So falls prevention is like number one, two, three on my list because it directly impacts and affects premiums. And that's something people may not be aware of. And as Dr. Paster said this morning, Wisconsin being number one for falls, hospitalizations, and deaths is directly impacting premiums each year when we go through health plan negotiations. I'm also the vice captain of the Black Men Run Madison chapter. So I work closely with Aaron Perry. Falls prevention, again, number one on our list when we get some of our elderly members of Black Men Run involved with what we do every Saturday morning on our 4-mile run and walk, as well as the Rebalance Life Wellness Association, which I'll be talking a little bit about later. I'm also a member of the 100 Black Men of Madison, where I am the director of the Wellness and Health Program Initiative. So falls prevention, again, very important. As you know, probably know, a lot of our members are getting up there in age. So falls prevention, again, is number one on our list. And as I was listening to Dr. Paster this morning, he touched on just about everything I was going to mention as far as prevention. There's some other things I'm going to throw out in there as well. But I thank you all for having me, and I'm looking very forward to this discussion as well as some of the questions that are going to be asked.
Well, thank you, Mr. White, for that awesome introduction of yourself. And one of the things I didn't think about how falls impact our premiums. But hey, that might explain some of why our insurance keep rising every year. Exactly. But just so we're aware of all the impact that falls have, not just, on us physically, but it's also impacting our pockets. So thank you for that. Next person we will hear from is Miss Charlie Daniel of the African American Opioid Coalition, the DEI manager at Safe Communities. Miss Charlie.
Thank you so much, Dr. Corinda. Thank you so much, everyone, for being here today. Well, I'm proud to say I'm old. I am an old person, and I am an old person who failed 10 years ago. And the effect I will be talking to you about after the fall. And I will be telling you about the effects that the fall had on me from 10 years ago and the chronic pain that I suffer with daily from that fall from 10 years ago. I'm old, I'm proud, and happy to be here with you today. Thank you.
Thank you for that introduction, Miss Charlie. If we all live long enough, we blessed to live to be old as well. So thank you. We appreciate having you and your wisdom that you bring to this panel today. Our next panelist is Dr. Judy Duane from the Associate Professor of Physical Therapy Program at UW-Madison. Dr. Duane.
Thank you so much for inviting me, and thank you all for caring about falls. Just briefly, I have a really cool role. I get to work with PT students and teach them the importance of fall prevention. In honor of this program, they all got their steady training, and I'll talk about that sometime, but they're all concerned, regardless of what area of PT they go into. And I shared with them a comment I heard from more than one patient out in clinical practice, and that is, we just fall. That's going to happen. And I guess one of the big take-homes I want everyone to take away from this is that the majority of falls are preventable. There's things that we can all do we don't fall just because of one reason. We usually fall because of several things that kind of build up risk factors. And so if we can identify the risk factors and change which ones we can, the risk of falls goes down. And to me, that's exciting. The other role I have is on the national level, I'm working with the American Physical Therapy Association to work on creating a standard where all physical therapists really address falls at a consistent level. Because right now, I hear from people, I went to this physical therapist and they just gave me an exercise program and sent me away. Well, we know that you have to make the exercises harder over time. But if you're not seeing anybody, how do you know to do that? And so we're looking at trying to raise the healthcare standard of care so that we can help reduce the risk factors. So we'll talk more about that later, but thank you again for letting me come and share.
Thank you, Dr. Duane. And I hope everyone heard that the majority of falls are preventable. And if we can change those risk factors, the ones that we can, we know we can't change all of them, but the ones that we can, the risk goes down. And so that's one of the reasons we're doing this panel today, because we want you to be doing the things that you can in order to change those risk factors so that you're not falling and only the leaves are falling. So I'm going to start with asking our panelists some questions. Again, a reminder, if you have questions, please put those in the chat. And my first question to the panelists is, let's start with each panelist talking about the impact they see falls having on their clients, community, family, or even themselves. And I'm just going to start with you, Ms. Charlie, because you sort of started talking about some impact on your own personal self.
Right. Thank you so much, Corinda. Yeah, when I fell 10 years ago, I was walking in front of a building, and it was in February. And what happened is the sidewalk was uneven, and I fell. But before that, I had experienced falling. Every now and then I would be out giving a presentation, and I would get up and I would start walking and I would fall. And I'm like, what is wrong? And I'm thinking it's got to be something with my medication. So I discussed this with my primary doctor that, hey, I'm falling and I have no reason. I don't know why I'm falling, but I'm having these episodes where I fall. And we decided that maybe it might have been one of my blood pressure medications, which I was taken off of that medication, and it worked. So I didn't fall as much. But then I had this big fall in February, icy in front of a building, uneven sidewalk. And from there, when I fell, I was rushed to the emergency room. And from there, everything just took this rolling effect of what was going on with me and my back. And so I ended up having to have back surgery in 2018. And I went from using a cane, which I thought, oh God, I'm old. I'm using a cane. I went from using a cane to a walker. Oh, I'm really old. I'm using a walker now. Now I use a combination of a walker wheelchair. And I need both of them in order to be mobile. So the effect that it has had on me, not only on me, but the effect that my fall has had on my family. It has changed the dynamics of my family. I now have a husband who now is my primary caregiver. If it wasn't for him, I don't know if I would have been able to make it. I would probably have had to have hired a caregiver to help me with a lot of the things that's going on in my home. I'm very blessed to have this wonderful man in my life who's been able to take care of me. I'm also so blessed to have a wonderful daughter and granddaughter who has been taking care of me through all this process. So it has affected my family. And I thought about it last weekend. It really hit home for me is when my granddaughter came home from college for a visit. And we usually did this, the three of us would do what we would call back to school shopping. where we would go to different malls within the state and do clothes shopping for my granddaughter. And we would have this big day, the three of us, shopping, spending more money than we should, of course, and having dinner, just being in the company of each other, loving on each other, and just really enjoying each other's company. I could not do that this year. I could not do that trip. And it really depressed me that I was not able to do this with my family. So I'll talk about this later on too, about the effect of falling, especially after the fall, and how depression sets in and the effect that it will have on your family member. Thank you.
Thank you, Ms. Charlie, for sharing parts of your journey with us with falls. Next, I'm going to ask the same question to Mr. White, if you can address that same question.
Wow, I'm still feeling the effects of what Miss Charlie just said. In my field, again, premiums. So what we saw last year with the health plans in the state of Wisconsin is them wanting to increase their premiums exponentially. Now, at first glance, we're thinking it's a global pandemic. It has everything to do with it. That was only part of it. What we saw was that the effects of COVID-19 on our elderly population leading to falls. The nationwide average was $50 billion being spent on hospitalizations due to falls. Okay, the health plans look at that, and that goes into their equation for premiums based on claims. Almost 70% of claims for the elderly in the state of Wisconsin last year were due to falls. So in the negotiation process with our health plans, they were the most strenuous this year, trying to get them to, make premiums affordable. And eventually we did reach a point where they are affordable. But my point here is falls directly impacted what I do, especially this year, given the amount of falls witnessed due to the pandemic. And that's something I think people, don't necessarily think about. And Miss Charlie touched on it perfectly. Depression after the fall. We saw a lot of that in the claims processing going on with the health plans within the state of Wisconsin. And so right there, we're thinking of initiatives to prevent falls. And that's what we're working on internally as the state's health department as well.
So thank you for that. And you and Ms. Charlie both touched on depression, and we'll talk a little bit more about that and the impact that has, not just on the individual who has fallen, but also on the families as well. Because the one thing that we know is that the falls might happen to an individual person, but it really does impact the whole family in some very big and different ways. And so, and some of it is, it continues to build from the fall, like the next phase of that. And we don't often talk about what happens after people fall, right? And so I think that's important, and we will be touching on that later. But before we do that, I want to jump to the same question to Ms. Duane, and then I'll go to Ms. Osborne.
Thanks, Dr. Kunda. Couple of things that strike me when I think about this is what happens even if people haven't fallen, but they're afraid they're going to fall. People are more educated. We have so many places to get information, and people are reading that 1 in 4 older adults fall, that people die if they've fallen. Some people end up in nursing homes if they've fallen. And so I see people coming to see me who maybe haven't fallen, but are so fearful they're gonna fall. And when people are fearful of falling, they move differently. Think about it yourself. When you go outside and it's icy, we walk with our feet farther apart. We tend to stiffen things up. That's natural. Well, if you're fearful of falling, you're doing that at times when that's not helpful. And you're actually putting yourself at more risk. And so, one of the things I see as a physical therapist is it's not just getting someone stronger or working on their balance. Yes, we do those things. But it's also working on people's confidence to figure out, when am I putting myself at risk or am I not? And some of the thought process and decision making. And I'll give you one quick example, and then I'll step aside. Many people, as they get older, have arthritis. I have very severe arthritis in my knees and hips. And some days you're stiffer than others. Part of fall prevention is knowing yourself enough to know, gee, I'm really stiff today. I'm shuffling my feet a little more. I have to be more careful if I go walk on grass that's uneven. Or tomorrow, my knees, gee, everything's a little looser today. I'm moving well. And it's easier for me to walk on the grass. And that ability to adapt. Part of fall prevention is adapting. And one of the things that I think it's important we do is learn how to read ourselves so we can adapt in the world given our risk factors. So we can talk more about that, but yeah, thank you.
Thank you. How we can adapt, because we can make different adaptations to our lifestyle and to the way that we move in order to prevent these falls. And so thank you for Dr. Duane. We will be exploring more of that. Dr. Rowan.
So I think one thing that, to go back to Mr. Wright's point, is the effect of COVID-19 on everybody's ability to socialize, to get out. One thing that we do focus in family medicine on for prevention is, being able to exercise, being able to get outside. And I think because of the pandemic, it's just changed how people think, how much more thinking is involved in going to the grocery store even. But one thing that did not really change that much during the pandemic was the ability to be able to go outside. I mean, outside was one of the sort of the safer places where, we could be, outside and, sort of be able to maintain that 6-foot distance. And so, one thing that, we talk about with my, patients about fall prevention is developing a habit of, as much as possible, to be outside, even during the winter, where there's some areas where that may be, are regularly shoveled, or there may be a track. But because we know with age, our muscles atrophy, they get a little weaker. We're not as strong as we, as before. But one thing that is important is making sure that we don't lose the muscle that we have. And so getting into a habit of, if it's a walk every day, we plan, we're going to go to the track during the winter or somewhere that is, very safe, so that we can get that habit of getting outside and walking. I think that is really important to maintaining our strength, because core strength is really important. It boosts our confidence to be able to, walk. It preserves our muscle. And I think getting, that kind of helps people to, if you have a habit of getting up early or walking at lunchtime, then we will be able to kind of work around and increase people's confidence, because there is such a thing as post-fall anxiety. So especially people who are fallen, they're really scared to walk outside, walk in different areas because of the anxiety associated with it. And you add that to the COVID-19 anxiety, it's really a lot. But we really only want leaves to fall. My grandmother did have a fall, and she had issues with her hearing, issues with her sight, and that sort of contributed to that. And she never fully recovered. She got pneumonia and she eventually passed away, but it all started off with a fall. Falls, they do have a lot of ramifications for our health, for our families. But maybe getting into a habit of just getting outside and finding safe places to get outside so we can keep that movement, I think is really important.
Thank you, Dr. Rohan, for talking about that direct movement. I can attest to the need to keep your core strength up. From my father-in-law, when he retired, he did not get off the couch, did not go anywhere. And finally, when he went to try to go somewhere, he failed because he had lost his core strength. And even from there, it was, like you said, a trickle down effect because he actually was afraid to leave the house because he didn't know if he would fall and not be able. He was a big man, so not just anybody could help him get up because he was so big. But it definitely impacted his ability to be mobile in his retirement years because of that. And so I appreciate that. And I have a question from one of our audience members directly to, I'm going to direct it to you, Mr. White. And it says, what type of fall prevention initiatives is the state of Wisconsin implementing?
Yeah, so what we're looking at, we're going to the group insurance board with our data analysis. We work with IBM Watson, who's our data warehouse. And what they're doing is putting together, or we're going to request them to put together the data analytics on claims related to falls. From there, what we're going to look at, we're basically attacking it from the premium side. And then we're going to look at the program agreement to see if anything could be instituted in the state of Wisconsin's program agreement regarding falls and coverage. So that's basically in terms of prevention. What we're attacking is the monetary aspect of it, because as far as coverage under uniform benefits, someone's falls, that's covered through the state of Wisconsin through all health plans, so there's no problem there. What we're looking at is keeping those premiums and out-of-pocket costs down or reasonable in the event when falls occur.
Okay, thank you for that. So I have two questions. I think I'm going to, one I'm going to address to Dr. Osborne and then Dr. Duane. Who is more likely to suffer a fall? Is it women? Is it men? And who?
So women, and especially older women, are more likely to fall. And there are a combination of factors. Women, we do have less muscle, we have less bone mass, so that contributes to women being more likely not only to just fall, but have severe complications after a fall. But there are a number of disease processes that contribute to people falling. So arthritis was mentioned before by Dr. Duane. So arthritis, anemia, so low blood count. When you have low blood count, you stand up very quickly. The blood rushes to, your feet. That happens with people who have low blood pressure as well. But that contributes to falling. Not being able to see. So Dr. Paster had mentioned vision decrease. Sometimes there is a vision decrease with age. And so not being able to see. And then there are different neurological issues. So people who may have Parkinson's, people who may have nerve damage, they're not able to lift their feet as well. And so they can't avoid, if there's something in the way, they don't lift their feet high enough, they don't avoid it, and they fall. So medications is a big one. People who are on multiple medications, have a risk of falling, especially if they haven't been reviewed. So, so the one of the key things is to A lot of times, we have in family medicine the 15 minutes, we have 15 minutes to see everybody. And a lot of times you don't get time to address everything. But the one thing that, especially if you're on a lot of medications, bring all your medications to the office, at least once a year, have, your doctor, your provider look at the medications and see, do I need to be on all of these? Because things change, our bodies change, medicine changes, there are new recommendations, but we can't make a recommendation if we're seeing you if we don't have all your meds. I used to tell my patients, bring all the bags in, we'll sort them out, all the bottles, just bring it in. And, a lot of times we'd have them spread out, or we'd get the medical assistant or the nurse to kind of like look at all of them so that we make sure, because sometimes they're in a pill box, right? So we just kind of go to the pill box, whatever is in the morning, the afternoon, you take those, and sometimes not even thinking about what we're taking. And so that's kind of one thing. But the risk is with women, older folks, and then there are a bunch of diseases that would cause people to be more at risk of falling. But I think one thing that is modifiable or changeable to increase fall prevention would be to have medications reviewed at least once a year, so that we know what you're taking, you know what we're taking, it's appropriate what you're taking. If some meds could be cut down, I think that's really important too.
Thank you. And Dr. Duane, what are you seeing in your practice? More women, men?
Definitely more women fall if you look at the stats, but women often minimize the issues as well and don't always seek the help they need. So while I would agree with everything that Dr. Rowan said, being a woman, being older, being on multiple medications, some of the chronic diseases, people who have any cognitive impairment are at higher risk of falls. And one group that we haven't talked about, I'm just going to throw out since we are in Wisconsin, is people with low vitamin D levels. It's one of those things. I was talking to my brother who happens to be in New York, and he goes, "Can you believe it? My vitamin D is low." And I said, "Well, why are you surprised? We aren't out in the sun at all." And there's some good literature about how that affects our strength, how it affects our balance. And so even working with your primary care physicians to get that screened, I think is important. So I won't belabor this point because I think Dr. Ron said most of the things, but there's a couple more pieces.
Okay. Thank you so much. Vitamin D and COVID caused many of us not to get the vitamin D we need, because some of us didn't go out at all. We were in the house and we weren't doing getting out every day like Dr. Osborne mentioned. We were staying in. So we really do need to pay attention to what our vitamin D level is. So the next question I'm going to throw out is, can you talk about the stigma attached to falls and what can we do as a community to break down that stigma? Miss Charlie, you want to start?
Sure. Well, the stigma is that you're old, that only old people, like not only leaves fall, but only old people fall. But you're finding that that's not true.
Right.
The age range now is like 45 years old. People do fall, and they fall for various reasons. You got people who are chronic alcoholic. They fall constantly in their homes, people who have other types of diseases that causes them to fall. So the stigma really has always been that it's an old people thing, that only old people fall. And that is not true. I'm proud to say I'm an old person. I'm here because of the great, I have to say, the great medical care that I've had throughout this process. So, and one of the things that I want to talk about too, feedback on the most important person, when you talked, Dr. Orsborn, when you talked about the medication and how you have your patients come in and just spread their medication out on the table, that is wonderful. But the most important person in my care, what I've had throughout my life, has been my pharmacist. I depend on this guy named Charlie to tell me what medication interact with each other. Charlie, I started off working with Charlie when he was in pharmacy school. He is now a professor of pharmacy at the UW School of Pharmacy, and he's also head of pharmacy at one of the local outlets. So I don't put anything in my doctor. Dr. Osborne, my doctor can prescribe any medication that they want to. I don't put it in my mouth until Charlie tells me it's safe to put it in my mouth. And then we look at all the medications on the table that I'm taking, and then we'll discuss it. So I think it's very important not only to have a really good working relationship with your doctor, but also your pharmacist. So I know I went off the grid with that, but I'm saying the stigma that I've seen is always associated with being old.
And I appreciate you saying that, Miss Charlie, because it's not just old people falling, like you said, because 45 is certainly not old, right?
Right.
And so, and all of these meds can have some interactions with each other, which cause anybody to fall, especially if you haven't had them adjusted in quite a while. So thank you. Anyone else would like to address that in terms of our panelists?
Just quickly, the other stigma, I agree, Ms. Charlie, with what you said. The other stigma is that, oh, I'm falling. There's not much I can do. I mean, I'm falling. And that's incorrect too. Not only are most falls preventable, even if you have fallen, for many people, reducing the risk factors reduce the risk of another fall. There are things we can do. And I'd like to reach those people who hide it from others. I know my dad would fall and my parents wouldn't tell me. And I guess maybe they were embarrassed because I'm a physical therapist who works with people who fall. But I wasn't going to go and shove them in a nursing home or something. I did bug them about exercise. And my own father said, well, you know, they just had me stand up and sit down and go up on my toes. And that wasn't good physical therapy. Good physical therapy helps you understand how those exercises will help you over time. And so that's the other take home. Once you fall, you're not just in trouble. You can change that. Thanks.
Thank you. Go ahead, Mr. White.
I just wanted to mention one major stigma that we've seen personally with the Black Men Run group. We had a retired police officer in his 70s who joined us. He joined us as a result of a fall. He was talking to us about it for about 8 months. What can he do? And the stigma he felt, he told us, he said, I feel like I'm losing my independence. Like I need some assistance to be mobile. And he joined us. And at first, at 70 years old, he joined us for a 4-mile walk. Well, now this man can run 4 miles constantly. No break whatsoever, and outruns some of our 20 and 30-year-olds who need to stop. You know, it's amazing to watch. And so I say that because he did exactly what Judy Duane just said. He broke that stigma by, you know, reaching out for support and gaining his independence. So that stigma of losing your independence is huge, and gaining that back takes a lot of support as well.
Absolutely. Absolutely. And even Dr. Rohan mentioned, you know, there are things you can do, get out. But we also need to be asking the questions, you know, what can I do to maintain my independence, right? And as we talked about, folks are oftentimes afraid to even mention that they're falling, let alone what can they do about it, because we assume that there's nothing that can be done. And as you said, this man is 70 and is running 4 miles now. So unbelievable. So there are things that we can do, and we can support each other through that, right? But we can also connect people with resources, because I'm sure nobody was thinking that join a Black Man Run group and that's one way to maintain your independence. But what he's learned is he's not only learned how to maintain his independence, but he's now getting exercise, which is also better for his health all around, right? And he also has the support of his encouragement. But I also want to say the one thing that's also important is that we meet people where they are. Because when he came to you guys first at the 100 Black Men, you all didn't say, well, let's run a 4 mile run. He was walking, right? So we took different steps to be able to get to the next level of running. But we meet people where they are, and then work with them to build trust, because trust is huge in all of this. We heard Miss Charlie talk about it with her pharmacist. She said, I don't put nothing in my mouth unless I checked it out with the pharmacist. So she has built trust with that pharmacist, and he's built trust with you all. And so we do have to work on our relationships with folks too, so that they can trust us enough to be able to give us the information that we need in order to be able to help them to be more independent. So I just appreciate you. I appreciate Dr. Wayne talking about the trust issues with her father and his fall, and Ms. Charlie talking about that as well. So I do have another question from one of our audience. It says, please give us some detailed information on how to avoid falls during winter weather and other slippery outdoor conditions. So who would like to tackle that? Ms. Duane.
So we have a lot of snow and ice here in Wisconsin. And so there's a couple of things you can do to prepare yourself for the winter weather. One is, keep sidewalks clear. And if that means someone else, you need to hire the local person next door to shovel for you. That's important. You want to keep your sidewalks clear. There is something known as yak tracks. Yak tracks are something you can attach to your shoes to basically increase the traction. And they work great. I mean, we've actually done a couple studies here in Wisconsin that have shown using what they call yak tracks, Y-A-K tracks. You can get them like from a Dick's Sporting Goods. You can get them on Amazon, and you put them on your shoes, and you go outside, and you get good traction. Because let's face it, not all our boots and stuff are equal in that. The one caution I have for you is yak tracks. If you put them on your shoes or your boots, and then you walk on linoleum, it's really slick. They're made for the outside. So what I have people do is, and for some people, it's really hard to reach down and put them on while the boots are on your feet. So I have people, who have maybe put a chair near the door, and they have their boots with their yak tracks already on them, and they sit there and they put them on right there. So then they go right out with them on versus trying to walk through the house. Those are just a couple of ideas.
Anyone else?
I also wanted to mention, we talk about mindfulness when we want to talk about, just being in the moment. But a lot of times we get distracted and try to do a lot when we're walking, so just, trying to focus on whatever. If we're carrying something, if we're walking outside, we're not going to try to be reaching for something, walking, the dog's pulling, the grandkid is over there. And, then, because that increases your risk of falling, because, multitasking, gets a little slower as you get a little older, right? I can't do as many things as I used to do, before and do them all at one time. And so I think just being aware that, you need to be in the present when we're walking, especially if we're outside in the winter. We have to be even more careful that we're not trying to do a lot when trying to walk, because it increases the risk for everybody, not just people who are older, but even, people who are younger. They try to do too much, and you can end up slipping and falling. So that's just one thing to try to remember as well.
I would like to say that I agree with you, Dr. Osborne. You should be in the moment, when you're walking. And I am in awe when I'm out, especially with young people on cell phones and walking. I'm surprised there haven't been a lot more accidents of young people falling from just on their cell phone while they're walking, and they're texting, they're doing. It's unbelievable. They have their head down and they're walking and they're texting. And one of the funniest, and it's not funny, but one of the funniest cartoons that I've seen is folks texting and walking and falling in manholes. It's not funny, but it is funny. Because you just walking and texting, and all at once you've fallen into a manhole. And I just think young people just need to be in the moment. I mean, you're walking, enjoy the scenery, look around you, enjoy nature, and put that cell phone down. Sorry, I didn't mean to cut you off, Corinda.
Oh no, you're perfect. Thank you so much. And I think it's not just young people walking around with these cells that need to be more attentive. It's all of us, because I think we all pretty much walk around with the phones in our hands a little too much, not observing our surroundings and our environment, and being in nature and just being, just like you talked about. Mr. White, you wanted to address that question.
Yes, I was just going to go right along with what Dr. Osborne said, and that is be mindful and take the path of least resistance in the snow in the wintertime. Look at the route that you're taking. Take the safest route from point A to point B as you're walking in these slippery conditions.
And I'll just add to that the lighting too, and those because some lighting in some areas, we know the lighting ain't that great. So try to walk in areas where there's much more light, so you could actually see what's out there and what's in the way as you're walking. I have a question that comes from our audience. It says, can the panelists talk about some of the side benefits of Dr. Rowan's suggestion to walk outside daily? Can that help with other physical conditions or even cognitive ones?
Yeah, so most definitely, physical ones. We talk about cardiovascular health, which means heart health, basically. So walking and getting physical activity does help reduce blood pressure. It reduces blood sugar because you're using the sugar to feed the muscles. It can help with cholesterol for those that, may not have a familial component or it's not in the family. And then cognition, most definitely. It really helps with, it doesn't prevent, we don't have a direct relationship between, like, say, preventing Alzheimer's and activity, but we know that activity helps keep people's minds active. And so, there's a lot of information around the benefits of physical activity. And those are just a few of them. I mean, especially if you can do it in the social sense. If I walk with a walking group Saturdays and Sundays, and sometimes it's you don't want to walk, but you know that your friend is going to be out walking, and sometimes that's an incentive. So the ability to socialize in a safe way is possible when exercising, because that is another concern with the pandemic. It allows you to socialize. It helps your heart. It helps your cholesterol. It helps your sugar. It helps your blood pressure. The important thing, if you have not walked or you haven't walked in a long time or you are a little concerned about doing that, is, checking with your doctor. Make sure everything is okay. Walking may not be suitable for folks who, have issues with their feet, who have, peripheral neuropathy. So you want to check in with your doctor if you haven't gotten into that habit. You want to check in with your doctor and make sure that it's okay. But walking definitely has more benefits than I think we even know.
And I'm very glad you said what you said about social, because I'm Facebook friends with you, Dr. Ortsman. And the most beautiful pictures are when you walking with your group, and you ladies like you're having so much fun with each other. So it stops the isolation, especially with COVID. You can get out. That's one safe place where you can get out and be with people, and just have a good time. And you ladies look like you're having such a wonderful time walking with each other. And another great group, our brother White, is that 100 Black Men, and also Aaron's group. Aaron. I mean, the group that Aaron has started in walking. I mean, it's beautiful to see these beautiful Black men and young boys walking with each other and knowing. And see, the thing is, what I like about Aaron's group is that you are teaching, that you older guys are teaching these young Black men the benefit of good health, right? And I remember as a kid, we walked everywhere. That's all we did. We didn't get on buses. We didn't have cars to take us anywhere. Like we now drop our kids off everywhere. We walked as a kid. We walked everywhere. That was, and we didn't think of it as an exercise. That's just something we did. We just walked. So the isolation, the benefit of walking is to be with other people who are look like they're having fun with each other. And that's what I see, Dr. Osborne, when I see you and your lady friends walking. You look like you really enjoy being with each other. And also Brother White, when Aaron and your group are walking. So kudos to both of you.
And Miss Charlie, you mentioned both of those walking groups, and both of those walking groups actually meet folks where they are. Because Roanne and them sometimes run. They don't always walk. They sometimes run too. They run a lot, but they are very open to folks joining them and doing as much of the walk as they can. You don't have to walk as far as them. You can walk as much, because let's trust it. I've walked a couple times with Miss Roanne and her group, and I'm not there yet physically where I can keep up with them. So I walk as much as I can, and then I pull back, and they're okay with that. And so I really do appreciate that both of those groups really meet folks where they are, and you don't have to walk at a certain pace. You can walk at your own pace. And I know that both their models, from what I've seen, is no person get left behind. You can turn around when you want to, but you're not going to get left behind just because you can't keep up. And so I just appreciate that as well. So that social isolation, that support you get, and that camaraderie, you can't beat it. So Ms. Duane, did you want to address that question before we move on to our next question?
The only thing I want to say is, for all the reasons walking is wonderful, but I have a student sitting in the room with me who's holding up a sign saying, but are you going to tell them that the literature says walking does not improve balance? So I'm going to address that. We need walking for all the reasons people said, for health, for community, for all of those things. So I'm not saying don't walk. It's important. But equally important is to work on balance exercises that get harder and harder and harder. And for some people, starting walking, just walking, takes a lot of balance. So it might help their balance at first. But once you're walking well, then you have to make it even a little harder. And so there are, whether you go to a physical therapist or we do have community programs that work on balance as well to address some of the social isolationism, but to work on progressive balance and some of the other risk factors too. So I just wanted to add that little piece. And now my student is putting down the sign, so that's good.
Thank you so much. We appreciate that because because that's why we're here. We want all the information, right? We want to make sure people are safe and doing what they can do to take care of themselves, but we also don't want people falling. So prevention and education and giving people accurate information is so important. So we appreciate that. So I'm going to go to the next question. And my next question is, what advice do you have for a caregiver who is concerned about a loved one falling?
So for the person who's looking after someone who has fallen, I think it's really important to, make sure that this gets addressed with their physician, because as we said before, a lot of stigma happens with, wanting to tell your provider or your physician about falling. So you want to make sure that you go with the person you're looking after and make sure that fall prevention is addressed and looked at. And if there's a referral to physical therapy, that happens as well, because you're advocating for your family member in a way that they may not feel comfortable advocating or may not want to mention. So being the advocate, especially in the physician's office, I think is really important.
Mr. White?
Yeah, words out of my mouth, Dr. Osborne again. Be open. Caregivers speak openly if you suspect that a loved one has fallen. Be kind, but get in there and find out as much information as you can from this loved one. Have they experienced a fall? Because in a lot of cases, especially what I've seen is reluctancy to tell you or admit that you have fallen. So that's one thing. Then from there, if they're on medications, keep a list of those. Take a list of those before you talk to that caregiver, because many of those side effects can be contributing to this fall. So it's important that physician, that primary care physician, knows what type of medication that loved one is on. So you want to keep a list, and then tell the doctor if you suspect the fall. Go in with that loved one. Be there as a support for that loved one to let them know, hey, you're not being ostracized. There's no stigma being attached here. We're here to help you.
Ms. Duane, you were going to address that question.
Well, and just to add to what Dr. Osborne and Mr. White have said, also find out as a caregiver, how do you help if someone falls so that you don't get hurt yourself? For your loved one, what does that mean? For one person, it might mean as long as you get a sturdy chair over to the person, they can get up. Your person's good enough. Or if you just hold here, you don't want to be pulling on their arm because then you're tipping them over. Work with your healthcare person to know, how do I help them? How do I help them in the bathroom? How do I help them? It takes a situation from scary to, okay, I'm empowered to do something. And I think that's important. And likewise, if the person themselves that has fallen, if you can give them the ability to tell others how to help them, then they don't lose control. I think it's horrible when I hear the stories my patients tell me. They tell me they fell and they didn't know how to get up. And then people just kind of lifted them up and they lost all control, and they feel like they lose their dignity and they become ashamed. And I think we need to do better informing caregivers and informing the people themselves. If you have fallen, how do you help yourself? Or how do you tell someone to help you safely? So that's what I wanted to add.
Absolutely. And I think you touched on some really great points. That is, in helping folks, you also have to make sure you're safe, right? You can't be putting yourself at risk, because if you're injured, then you're not going to be able to help that person. So the goal is to be able to get the person what they need without harming yourself. Miss Charlie, did you want to address that?
Yeah, I was want to say one of the hardest jobs that you could ever have as a caregiver. And especially if you are, as a loved one, if you're taking care of a family, like my husband is taking care of me as a caregiver. He's helping me out a lot. It's very hard on him, I'm sure, you know, that he not only has to think about me, but also himself, you know, when he's helping me get up and out of a chair, and he has to be able to know where to grab me to get me get up out of the chair so he won't fall and hurt himself. The most, caregivers are not given their dues like they should, and especially caregivers who are taking care of their loved ones. Your partners, your children, your mom and dad. They give up a lot to be caregivers. We've had people to be caregivers, especially when I was working at Alzheimer's. People have given up their jobs to stay at home to take care of their loved ones who suffer from Alzheimer's. So you give up a lot, really, to be a caregiver. And it should be, Ashley, I know you're listening, it should be some grant we can write where we can have classes for caregivers who are taking care of people who have fallen or afraid that they will be, fall in the future or whatever. But we should be offering some type of class for caregivers to help them out when they're taking care of their loved ones, because you don't know, you just start taking care of people without any instructions at all. So we need to look at helping the caregiver more than what we do.
Absolutely. I would agree. In offering caregiver support is also very much needed. They don't ask for it, but it's so needed. That self-care and taking care of themselves as a caregiver is very much needed. So we need to continue to do that. And one of the things that I really appreciate, Dr. Duane, you said, is that we need to ask people what they need from us in order to help them, right? We can't just walk in and assume that every person who falls needs the exact same thing, because that's not true. Every individual have their own individual needs, and they are the experts in their own lives, so they can tell you exactly what they need, and be able to allow you to help them in a way that's going to also allow them to have some dignity and respect in that space. So I'm going to pivot a little bit to some direct, not personal questions, but some direct questions that have been asked to provide to each of you, depending on your expertise. So my first question is to Mr. White. There's been some amazing work done in our community around the health of African American men. What else can we do to further incorporate falls prevention efforts among African American men?
I think the first thing we can do is let African American men know that there are support groups out there in these situations. The Rebalance Life Wellness Association here in Madison, one outlet. It's a pretty major outlet. That association alone, we have screenings, biometric screenings on site. The health centers are located at the barbershops within the Black community. And as we know, the Black community, or the barbershop, is a huge resource for information for Black men within the Black community. I mean, we go there not only to try to look aesthetically appealing, but mental stimulation as well, and find out resources. And located next to many of our barbershops are those health centers where we have resources that discuss falls prevention. We discuss biometric screenings, pre-existing conditions, We talk a lot about that, the encouragement and reasons for those screenings, all tying into falls prevention. Along with staying active. Dr. Osborne mentioned earlier muscle atrophy. We talk about as you age, things to expect, muscle atrophy, and support groups to become part of the Black Men Run, things of that nature to try to remain active, remain mobile. So that's another thing. We encourage you to get annual screenings for pre-existing conditions. As Black men, we know it's September, it's Prostate Cancer Awareness Month. We talk about prostate cancer and the importance of getting screened earlier rather than later, things of that nature. Other pre-existing conditions, high cholesterol, high blood pressure, everything contributing to falls. We know that as African American men, we make up a larger percentage of chronic diseases and functional limitations. So what we do is try to steer Black men to these support groups to understand that here are resources that you can refer to in the event to prevent falls from even occurring. One major thing I want to throw out there, and then I'll wrap up and we'll get to the next person, is we encourage Black men to establish a relationship with the medical community and your primary care physician in particular. If you don't know how, at the Rebalance Life Wellness Association, we teach you how. So that's it. I'll go to the next person.
So that's huge, establishing a relationship with the medical community, right? And I like what you said. You said, if you don't know how, we teach you that, because we always make assumptions that people know how to talk, how to advocate for themselves, how to access services, and not everybody do. Some of these systems are set up in ways that even us educated folks have trouble navigating some of them sometimes. So I just appreciate that you guys don't make the assumptions. You walk people through what they need in order to be able to get the help and the services and support that they need in order to have fulfilling lives, because that's really what we want, folks to have fulfilling lives, which impacts their ability to have a quality lifestyle, right? So I appreciate that. And I have a question for you, Dr. Duane. It says, we always hear that it's important to keep moving, but can you please tell us how important that really is as we age and strive to maintain independence and a high quality of life?
That's a great question. You can kind of sum it up as use it or lose it. You know, Miss Charlie talked about as a kid, she walked everywhere. And then we get older, we start driving cars, we don't walk as much. So what we know is the more we strengthen, we get stronger, regardless of if you're young or old. Even if you're old, you can get stronger. You really can. If we work on our balance gets better. Wherever you're starting from, your balance will get better. And there's really a continuum of activities, right? I mean, you may not be falling, you're just fearful, you have some risk factors. So you may do well in a community program that helps you stay motivated to do things. You know, everything from stepping up or Chicago swing or ballroom basics for better balance or bowling. Even bowling, which kind of perturbs your balance, has been shown to keep our balance better as we get older. And so finding the activity that's meaningful for you, that you're motivated to do, and then working on that with some guidance sometimes. I mean, it can make all the difference in the world. And that idea of healthy aging in place. You know, what's important to you and doing activities that get your balance, get your strength, get your flexibility more and more. So I could go on all day about this, but I'll stop.
Well, the key takeaway from that statement you said is if we don't use it, we lose it, right? And we can all strengthen ourselves, right? It doesn't matter if you're aging or old, as Miss Charlie say. We can all strengthen our bodies in different ways, and not every person has to do it the same way, right? So find some meaningful activity that works for you and do it the way that works for you, right? So Miss Charlie, I have a question for you. You talked a little bit, you said you talked a little bit that you suffered a fall several years ago, and you mentioned some depression that came with that. Can you talk about what you did and how you overcame your depression after your fall?
Yeah, what happens, well, for a person like me who's so active in the community, who out and about, love people, love being around people, love to hug, stop that with COVID, of course, just love to be out and about with people. And wasn't able to do that for a while. Was able, because after I had my surgery, I went into a rehab hospital. And let me give some kudos to people who have this letters behind them. PT, OT, MA, NA, MD. All of those people were so important in my rehab, right? I've never enjoyed, and I was so lucky that I was around those OTs, PTs, MDs, MAs, NAs, who really, really took good care of me, right? And so the depression that I had, Corinda, was that I wasn't able to get up and about on my own as much as I lost a lot of my independence, right? And I just want to say that just because you fall doesn't mean that your life is over with. I have to give kudos to Safe Communities, right? That's the agency I work for. Never once did I feel as though I was not a member of the team. I was always a member of Safe Communities team. They were always there for me. I didn't have to worry about insurance or continue with my pay. None of that happened. And that happens to a lot of people when they fall. They don't have insurance to carry them through. They don't have a paycheck. But I was lucky enough that none of that happened to me. So depression came in with me not being able to be out and about and to be around people, which gradually changed because I was able to get out and about and still do the work that I love doing. And before I go, I just want to say, things happen for a reason. And Aaron Perry knew who to have his replacement today. Brother White, the information that you have brought forth today has been so important that we have never even talked about. We need you to come back and just do a presentation by yourself, because the information that you have given us today is so important that we had never even thought about discussing. So thank you so much I just want to say thank you so much for being here today and presenting with us. And I just
go ahead, Ms. Charlie.
I just want to say to the person who wanted to ask me that question is you just got to have another a letter that behind it. You got to have people that has the ML behind them and the TD, and that's Marvin Lauderdale and Tracy Daniel and Steve Dane, to help you out of the depression, because they were not going to let me sit around and feel sorry. I wanted to feel sorry for myself so bad. Oh, woe is me. Like, oh no, not up in here, lady. And no pity party going for you. So I was fortunate enough to have folks in my life that helped me get out of the depression that I was suffering from.
Absolutely. And I think that it's something we don't talk enough about either, is because following any injury or illness oftentimes do come with depression, but we don't talk about it, and it usually catches people off guard because they don't expect it, right? And then not only do they not expect it, they don't know how to deal with it or how to handle it. And then their family folks don't know how to handle it. But thank goodness for folks like Marvin and Tracy, who were there for you, Miss Charlie, who say, okay, well, you can be depressed for a little bit, but you ain't going to stay there because we're going to get you back up and get you moving. And everybody who knows you, Miss Charlie, we know that you always out and about in the community, and folks love you for all that you do on behalf of the community, because we know how much this community means to you. And I want to give you all just a couple minutes just to say a couple parting words to your audience before I close us out. Mr. White, we'll start with you.
First off, Miss Charlie, thank you. Thank you so much. That greatly appreciated. Touched me. Wow. I will gladly come back and do a presentation on my own, or with anybody who wants to, with me as well. This was great. I've never attended a falls prevention presentation, and this was wonderful. Of course, I've worked with falls prevention as part of my job, but this was nice to see others besides my coworkers who I work with daily also attacking it from many different angles. This was beautiful, and it's nice to have Miss Charlie here to give us her personal experience as well. So I thank everybody for having me, and Aaron missed out today.
Thank you, Mr. White. Miss Duane.
Thank you, everybody, for listening and sharing. This has been enlightening to me as well. But remember, falls are preventable. The vast majority are preventable. And so learning your risk factors and addressing them really does make a difference. And resources like Safe Communities, there's many programs that are listed there that we couldn't go through today. You know, please call, ask for those things, and the staff will help you get the resources you need and get to the right thing.
Thank you. Miss Charlie.
Well, I think I've said it all.
All right.
Yeah, I'm just happy to be here.
Miss Charlie.
Yeah.
Dr. Roanne.
I just want to thank everyone. I really enjoyed your questions, and with being able to be on this panel, I really appreciate the opportunity to do that. And I just want to ask folks to remember to be advocates for themselves, because it seems like your physicians, your providers are busy. We are busy, but we're also here for you. So don't be afraid to ask. Don't be afraid to ask for the referral to physical therapy. Don't be afraid to rope us in about the things that you are concerned about, because as Dr. Duane said, falls are preventable, and we definitely want to make that move from near the top for falls to kind of near the bottom for Wisconsin.
Thank you. I just want to say thank you. This has been a fantastic, well spent time for me, and I'm pretty sure the audience is feeling the same way. I appreciate having all of you. Thank you, Dr. Zorba Paster, for being here, and our amazing panelists. You all were awesome. Thank you again to our sponsors, Safe Communities, Dane County Falls Prevention Task Force, the Area Agency on Aging of Dane County, the African American Opioid Coalition, United Way of Dane County, and the City of Fitchburg's FACT TV. And thank you for tuning in. We appreciate having our audience with us here today. Please contact your local senior center, the Aging and Disabilities Resource Center, or Safe Communities if you have questions or for additional information. And for a one-on-one follow-up, please let Ashley know if you'd like to receive a free virtual home assessment or talk about other helpful resources to help keep you move, to help keep you or your loved ones independent and upright, because we know that only leaves should fall, not you. And Dr. Zorba Paster said it best, that we want to keep you all upright and as mobile and as independent as possible. So there are resources out there, and we would like to make those resources available to you. And so just a reminder, what can you do to prevent fall? Get those annual checkups. Keep, like Dr. Rowan mentioned earlier, write down what's happening so that you can pass on that information to the doctor, because we all forget sometimes. So if you have it written down, you can just pass it on to your doctor. Remember to be your best self advocate, and look for those resources like 100 Black Men or the Girls on the Run, because those are some resources that can also support you in a variety of different ways. So we want to see you again this time next year. And thank you for joining us on behalf of Safe Communities. It has been my honor to be your facilitator today. Thank you, and have a great rest of your afternoon.